Hello, good day everyone. I am going to discuss how to assess the breast and axillae. In preparation, the first thing you need to do is to assemble equipments and supplies. Centimeter ruler. Let's begin the procedure. The first thing you need to do is to explain to the client what you are going to do, why it is necessary, and how she can cooperate.
Next is wash hands and observe other appropriate infection control procedures. Provide for client privacy.
Next is to determine the client's history. Breast self-examination technique used when performed in relation to the menstrual cycle. Breast masses and what was done about them. Any pain or tenderness in the breast in relation to the woman's menstrual cycle. Any discharge from the nipple. Medication history. Estrogen replacement therapy. Alcohol consumption. High-fat diet. Obesity. Use of oral contraceptive. Menarche before age 12, menopause after age 55, pregnancy after age 30. Inspect the breast for size, symmetry, and contour or shape while the client is in a sitting position.
As you can see, his breast is symmetrical to each other and there are no any lesions.
Inspect the skin of the breast for localized discolorations or hyperpigmentation, retraction, or dimpling, localized hypervascular areas, swelling, or edema.
As you can see, his breasts are smooth, they are even in color, there are no redness, there are no dimpling, there are no lesions, and there are no edema. Emphasize any retraction by having the client raise the arms above the head, push the hands together with elbows fixed, press the hands down on the hips. As you can see, there are no any retractions and any dimpling in his breast.
Inspect the areola area for size, shape, symmetry, color, surface characteristics, and any masses or lesions.
As you can see, the areola is symmetrical in size, shape, and in color, and there are no masses and any lesions.
Inspect the nipples for size, shape, position, color, discharge, and lesions.
The nipples should be evenly pigmented and should match the color of the areola. And in his nipples, there are no discharge and any lesions.
The axillary, subclavicular, and supraclavicular lymph nodes, and the client is seated with the arms abducted and supported on the nurse's forearm. Palpate the breast for masses, tenderness, and any discharge from the nipples. Palpate the areola and the nipples for masses. Compress each nipple to determine the presence of any discharge. Assess any discharge for amount, color, and consistency.
As you can see, there are no any discharge or any lesions found.
If discharge is present, milk the breast along its radius to identify the discharge-producing lobe. Teach the client the technique of self-breast examination.
Lastly, document findings in the client record.